Why is the approach for total hip replacement surgery better than other approaches? Hello, my name is Dr. Dan Albright. I'm an orthopedic surgeon in Raleigh, North Carolina, and I specialize in hip replacement operations. I started in practice in 1994 and trained a lot, specifically in the anterior approach, before in my training and then in my fellowship and then here in Raleigh. I have a model to try to explain that. Other approaches work. The posterior approach is very common in this country and means putting an incision on the back side of your hip. There's also the lateral approach, which I will do sometimes in particularly challenging cases, and then much more commonly I do the anterior approach. And I admit to being biased because there's some good literature supporting it, but more importantly, watching patients recover from an anterior approach is impressive. And the advantage is you split muscle. You divide the muscle. This is the only approach, the only major approach, where you don't cut muscle and tendon off of bone and then stitch it back. With the posterior approach and the lateral approach, you literally have to cut muscle off of bone, and that weakens the hip, and you can dislocate more. And then you have to stitch those muscles and tendons back. So I'm very partial to this anterior approach where there's a model obviously, but you basically divide, you separate the muscle. You don't cut it, you never stitch it back because you don't cut the muscle. And then the hip is very superficial when you come from the front, very superficial. In fact, people have a lot less fat from the front. If you have extra weight, it's usually on the side of your hips or the back of your hips. Going from the front is a much quicker approach to get to the hip. Dislocations are much less also. I literally have no hip replacement surgery. Day one, you get your hip replaced, you can squat, you can tie your shoes, you can bend, no precautions. That's a huge advantage for the anterior approach compared to other approaches. And that's the main thing. There's also less pain. It's a quicker recovery. People are off a cane sometimes within days to a week or two. So those are the main advantages of an anterior approach. And it's challenging unless you're trained with the proper mentors and equipment and all. But once you get it down, it goes real well and patients do well. If you're interested more in the anterior approach to the hip, I'm happy to see you at any time. My website is danalbrightmd.com. You can get my contact information there. For appointments, phone number 919-863-6808. Thanks.